Hi, this is Dr. Tom Rogers at Performance Medicine coming to you with a weekly Common Sense MD podcast. I have an interesting show for you today. I've got a couple common sense physical therapists, which you don't see a lot of. I know Ernie Dixon is, but these two guys are young Ernie Dixons. They figured it out about 30 years before Ernie did. As you know, Ernie Dixon works in my office as a physical therapist. He's a cash-only physical therapist. Like these guys. I mean, I think Ernie practiced for 30 years doing the routine insurance mode, and these guys have figured it out after being out for, a couple years? Yep. Josh Davis, Zach Jackson.
That's correct.
From TriStar Health and Rehab, Strength and Rehab. As you can see, these guys are fit. I mean, these guys are actually physical therapists, but really they're trainers as well. And I forget which one of you guys told me that little credo that I'm going to go by about rehab. Tell me about your little thing, because I'm going to use it.
Yeah. So rehab is training, and they're interchangeable.
Rehab is training. I love that because I've noticed in myself when I get hurt, you can't be as old as I am and work out a lot and bike, play tennis, do all these sports and not get hurt occasionally, especially as you degenerate like I am at 67 years old. But anyway, so I've figured out for myself that when I work through an injury, through strength training, it gets better. If I lay around and put ice on it and rest it, it never gets better. I mean, I couldn't do a push-up for 2 years because it hurt too much. And then one day I got so tired of not doing weights and push-ups, pull-ups, I just powered through it. Guess what happened? In about 2 weeks, I didn't have any pain. So the thing I like about these guys and talking with them, and Ben did an Outside the Box podcast with both you guys that you guys will want to tune into, is that they really think outside the box. And if you're like I am, a lot of what I learned in medical school was completely wrong. And you guys are just out of physical therapy school for a few short years, and you're starting to realize that a lot of what you learned was probably not exactly right either. I admire you for going into a cash-only practice as I did 16 years ago. What I found out for myself is it made me a better doctor. I got better patients because they wanted help. They wanted to get better. And I had a lot more time to spend with my patients. Now, tell me why you made this move. How did you see so far into the future and make that decision to have a cash-only physical therapy practice?
I think for me, it started back in PT school. I remember I'd be on a rotation and had this guy with a total ankle replacement. Maybe he was far out to where we could do some high-level stuff, and I'm like, we're going to do some, single leg press, some deadlifts. The list goes on and on. And my CI, he looked at what I was going to do. He said, we can't do any of this. I said, well, why not? He goes, well, we need to do so much heat and so much ultrasound. And it turns out it's all due to the reimbursement. So I never could give patients, in PT school and then my first year and a half out, the care that they truly deserved. So Josh reached out to me with this wild hair idea, and we ran with it, and here we are. And it's been the best decision we've made. You mentioned, we get to see people one-on-one, track them, follow them, give them a program that they deserve that's going to get them the results they need. And plus, I think Josh and I, a lot of PTs are, it's black or it's white. I think we do a great job of living in that gray area. That's where we want to be. There's different things and different components we can pull in. So, yeah, we're definitely not your typical therapist. We are certified strength and conditioning specialists, just with the title physical therapy. So we love what we do, and we definitely want to share that with others as well.
It certainly gives it a lot of credence that you're a physical therapist and also strength coaches, because I'm like you. I think that is therapy, is through working out. And you guys figured it out really early. So in other words, you guys, Josh, you feel like you're working for the patient instead of the insurance company?
100%. Yeah, I mean, and it's something that we're not limited, by the insurance, because, we get a diagnosis code in traditional therapy, not us, obviously. But then we have to revolve our treatment around that diagnosis code. Whereas now is if, somebody, for instance, I had somebody that come in with some low back pain, hadn't been able to deadlift high percentages in a long time, but he also had some golfer's elbow. well, we can treat both, you know what I mean? Whereas as far as the outpatient thing goes, in the traditional meals, and meals meaning the PT will have 3 or 4 patients at a time. You may get 15 minutes, per patient, because the other people will be on the, on the bike, on, whatever, on the new step, on the heat, while the PT is dying and trying to get documentation done from 10 people ago. So yeah, I mean, that's something that, the approach can be so individualized with us, and, we can really get down to why the injury happened and how we can prevent it and get you better than what you were before.
So you're getting to the root cause of the problem,
Correct.
and you're able to spend enough time with them to really take them through not only the rehab process, but something that's going to last for a lifetime as to how you work out, how you stay fit. I think that's a great correlation to my practice, in that I found that I was able to spend more time with the patient and not worry about a code, or, like you guys have to send them off for 15 minutes of heat packs. Now go with the tech and you work out, and in the meantime you're on a computer trying to get all these codes in so you'll get reimbursed. I mean, it's just the way it has to work for the insurance model. So when you step outside that box, it's a bold step. I mean, especially as young as you guys. I mean, I think I've been doing this 16 years. I'd already practiced for close to 20 years before I made the move. So you guys are way ahead of it. Do you find that with physical therapy, what got me was that when I'd have a patient that I needed an okay for them to get physical therapy, I mean, it actually requires a medical doctor's signature for you guys to do your work, which for me was just brainless, because here a form comes across my desk. Can we do this? You have a 3-page report. Can we do this to your patient? Well, yeah. Of course I'm going to sign it. You know more about it than I do. But that patient, to me, has a right to go in and consult you guys without a medical doctor. They don't need a medical doctor to tell them how to evaluate an injury or something like that. I just thought it was ridiculous that I had to sign a form for you guys to get insurance reimbursement. Didn't that kind of get up your crawl a little bit?
Yeah, for sure. And when it comes to that, we have direct access in the state of Tennessee now, which, they can come straight to us. So that is huge, especially where we're wanting to work with the youth athletic population and are working with them. If somebody's in the gym and they, strain their hamstring, or they're like, oh, they come up, gimpy on a sprint, they can come right over to us. We can eval them, on the spot, and then treat them there. So yeah, I mean, that was something that is, huge for the field anyway, was direct access. So yeah, it helped us out tremendously.
Yeah, kind of touching on what you mentioned. Like you said, it was annoying that had to come across your desk, and it's annoying for us too, because it doesn't matter. We'll use an assisted living facility example. If I know this person needs therapy, and we can't get the doctor for 3 or 4 or 5 or 6 days before we get the referral, it's like, well, we've lost a week that we could already be addressing this problem while that individual's just pretty much sitting around. So it's a pain, but thankfully we don't have to deal with that now.
Just absolutely ridiculous how it was. But anyway, I really like the way you guys think outside the box too, because I do a lot of research, a lot of reading, I work out a lot, and I've really been enamored by this guy named Ben, who does this program on the internet called Knees Over Toes. We were always taught that when you do a squat, you should never put your knees more forward than your toes. This guy totally has it backwards, and he says you should have your knees over your toes. Have you found that, and we were talking about back extensions as well, have you found that it works better if you use a full range of motion than it is the traditional way it's taught? What have you learned when you look outside the box with your training?
Yeah, for sure. I mean, when it comes to full range of motion, especially with knees over toes, I mean, if you can try to stand up with your vertical shin, good luck for a majority of the population, because the knee is going to go over the toes, and it's something we were even taught in PT school a handful of years ago. So that's what's kind of frustrating, is there's all these, fear-mongering, like Zach said earlier, demonizing movements like a deadlift, which we said earlier I am in love with. So, but, it's just something that there's such a big spectrum of ways that you can adjust that range of motion. So I wouldn't say full range of motion is always the main thing that we're trying to target, but it definitely needs to be the end goal if we can within that person's tissue tolerance and available range of motion. Because there may be somebody that just had a total knee replacement and they've got a certain amount of motion they can get, and that's about it. So we can work around that and still have them train at higher levels and still get good quality life out of it.
I'd love to train with you guys sometimes because you're on the same page I am, and I know you could probably help an old guy like me as well. But I've always thought that the 3 strength exercises that you should do is the bench press, the squat, and the deadlift. And you get those down and you kind of go from there. In other words, it's senseless to go work your biceps or maybe on some of the machines until you can get the bench, the deadlift, and the squat. And if you get older, you get scared to do a deadlift, especially if you've had back problems like I do. So walk me through this. Do you think I should be doing all those 3 exercises for overall fitness? I don't want to get big. I just want to have less pain, be more mobile. How would you approach something like that with a guy like me in my age group and my fitness level?
I think we kind of hit on that with Ben a little bit ago. When people get to a certain age, doctors or PTs or friends will say, nope, you don't need a deadlift, you don't need a squat, you don't need to do a forward weighted lunge. And when you ask patients, like, well, why is that? And they can't give you an answer just because someone told them and they don't know why. We want people to be able to do these movements for as long as they can. My goal for you would be when you're 85 years old, you're still pulling a bar from the floor. And if not, then we'll make modifications to that. And people also, you bring up the fact, okay, you're 50 years old. Do you go to the car and get groceries or have to carry stuff in and out? Yeah, okay. That's like a farmer carry type deal. When you're a little bit older and you have grandkids, do you want to be able to pick them up, help get them out of the bathtub, out of the car? Yeah, all right. We need to practice some deadlifts and squats. So it's very functional movements that I feel like definitely do not need to be demonized. If someone has an issue or pathology, we can work around that and prescribe a different movement that's going to elicit the same response. So yeah, people definitely need to be doing these exercises as much as they can.
So functional, full range of motion strength training. I found myself, I do a lot of band training, and I'm going to get a particular exercise that I'll do actually I'm not going to buy a sled, but I'm going to get a bungee cord where I can do backward, backward movements. Isn't it pretty cool to walk or run backwards? Doesn't that help your quads out a lot?
100%. Yeah, if you want to get a quad burn, you do that. And the good thing, like you said, with bands, it's accommodating resistance. So, the resistance and the weight's always changing. And like you said, when you get way back there, you're going to get more of a quad burn and more activation. So, yeah, I think that's great.
So less likely to get hurt.
Absolutely.
I think people my age are worried about, the reason they're scared of deadlifts is because they think they're going to hurt their back worse than it already hurts. And everybody my age, their back hurts. So you're saying that you need to learn to do correct form on these. You start out light and just work your way in, or do you get satisfied with a particular weight?
Yeah, and that's where the strength coach comes in, is that in PT school we had like one semester of exercise class, which is mind-boggling. It's literally what we do, but it's neither here nor there. So as far as strength coach goes, then we can break down the movement into specific motions, right? So with the deadlift, we're looking at a hip hinge. Hips go back first, knees are going to slightly bend. And then we can, as far as pulling from the floor, like Zach said, we wouldn't start there. We would elevate whatever implement you're using, kettlebell, barbell, dumbbell, whatever it is. And then you can lower the box as you get more range of motion or better motor control. Because the thing is a lot of people that the reason they're scared to deadlift is because poor positioning or prior injuries. Obviously that's one, but that's kind of something. We had a deadlift clinic last Tuesday, and somebody had a bulging disc, and she was terrified to deadlift. Well, it's something like, she didn't know if she could. Well, we got her up to 145 in 30 minutes and no pain. So it's kind of something, that it's not, I like to think we have like magic hands or whatever, but we didn't, it's simple positioning, cueing, and knowing what the movement looks like and what tissues are stressed and why they're being stressed. If there's an injury or anything like that, it's knowing how to work around those things Because if barbell deadlift is too hard, it puts your more forward trunk lean, more stress on the lower back. Do a trap bar deadlift, which is kind of the handles are on the side, get you more vertical torso and more leg drive. So it's just one of those things where if you ask the traditional therapists, which we consider ourselves to not be and pride ourselves to not be a traditional PT, I don't know that a lot of those PTs could tell you that. So that's kind of what we pride ourselves on is the strength aspect. Obviously with the strength part of our name, that's definitely what we kind of lean into.
I found that to be so true. Would you say the deadlift is the most? If you had to pick one exercise to do, would it be, besides walking or biking or whatever, would it be the deadlift because it gets your upper and lower body?
Josh would probably say deadlift. I'd pick squat, but they're both great.
Both way in there.
They're both way up. I mean, like we hit on. A deadlift. You're going to be doing that for the rest of your life. You're always going to be hopefully being able to pick stuff up off the floor. And squatting, being able to come back up after squatting down, pick something up. Those are the two that I feel are the most important. And unfortunately, those are the two that get demonized the most by the medical community. So it's our job to educate people and provide knowledge that these are safe, these are okay. Yes, depending on what's going on, we might need to make certain adjustments and work through different ranges of motion, but then our ultimate goal is to progress all the way to full range and keep you doing these for as long as you can.
I love that. One time I heard a ridiculous statement that somebody told me because I'd advised them to get a trainer to help them start working out. And they said the only reason that you would need a trainer is if you're too lazy or you've got too much money. And I thought, that's the most ridiculous statement I've ever heard in my life. I really think everybody, including guys like me, who I'm a doctor, I've been around athletics all my life, I kind of know what to do, but in a way, I don't. I need help with form and function if I want to get to where I want to get without getting hurt and to make the maximum. So I admire what you guys are doing. Obviously, we're on the same page, and I love the cash-only practice. I think you're going to be real happy. I don't think you'll ever go back to the traditional because it kind of forces you. Really, I found that you have to be better than the average physical therapist. I mean, you have to be a lot more forward-thinking. You have to spend more time with the patient. You just have to be plain better. They're not going to come to you. So congratulations for what you're doing. You're going to have a lot of events. If you're watching this, you need to go to Ben's Outside the Box podcast and listen to these guys talk in a little more detail and try to look them up, attend some of their functions that they're having. A deadlift party. I mean, I've never heard of that. I've heard of drinking parties and dance parties, but never a deadlift party. So to me, that's pretty cool. But congratulations on your business, and I'm sure going to send you business from people I see every day, not only my clinic, but my friends. So Josh and Zach, thank you for coming in here, and hopefully we'll do more of these things, maybe even some demos and things, and we'll see you guys next week. Thank you.
So when we met Dr. Rogers last week while we were filming the podcast, he complained to us about having chronic back pain for several years. So we came up with a good exercise for him. So with our warm-up and primer, we'll go to do some 90-90s, help loosen up the hips, thread the needle, which will work on thoracic rotation, goblet squats, just to build up some strength, get comfortable, get warmed up, and then our big one, strength. So we really want to have a strong back. If we can have a strong back, that's going to help take away some of the pain. Then we'll get into some of our accessory exercises, so rear foot elevated split squat. So with that, we get another pillar of the stool, so stability. With dumbbell rows, we're working on mobility, stability, and strength, and then cash out. So we've got a Plinko board for Dr. Rogers right here. He'll gum up, put the disc in, and whatever exercise it lands on, that's what he'll do to cash out and get out of his workout. So this is Dr. Tom Rogers' workout for today.